Blood transfusion is one of the most life-saving procedures in hospitals. But if even a small mistake happens during transfusion, it can lead to wrong blood transfusion, severe transfusion reactions, even patient death. That is why NABH introduced the COP-8 standard to ensure that blood and blood components are used safely and rationally in hospitals. What you will learn in this video. In this video we will clearly understand what NABH COP-8 standard says, what assesses check in transfusion services, common mistakes hospitals make, and how hospitals can become COP-8 compliant. Let's begin. What is NABH COP-8 standard? The COP-8 standard states, transfusion services are provided as per the scope of services of the organization, safely. This means hospitals must ensure safe availability of blood, proper blood transfusion protocols, patient safety during transfusion. The goal is to ensure safe and rational use of blood and blood components. Objective elements of COP-8. COP-8 includes several key elements such as scope of transfusion services, SOP for blood collection, testing, storage and distribution, safe storage of blood components, safe and rational use of blood, blood availability during emergencies, monitoring of transfusion reactions, transfusion quality assurance program. During NABH assessment, these elements are verified through blood transfusion records, SOP, committee reports. Scope of transfusion services. Hospitals must ensure that blood and blood components are available according to their services. These services may include in-house blood center, outsourced blood center. If blood services are outsourced, the hospital must maintain written MOU or agreement, safe blood transport with cold chain maintenance. Blood center resources. A blood center must have adequate infrastructure, equipment, trained manpower. This ensures that blood supply is available without delay. SOP for blood center activities. Blood centers must maintain written SOP for all activities. These SOP usually include donor selection, blood collection, blood testing, blood storage. These protocols help ensure safe blood management. Blood donor selection. Blood donation should only be accepted from healthy donors, voluntary donors, low-risk donors. This reduces the risk of transfusion-transmitted infections. Screening for transfusion-transmissible diseases. Before transfusion, blood must be screened for diseases such as HIV, hepatitis B, hepatitis C, syphilis. This screening is called TTI screening and is essential for patient safety. Blood storage. Blood and blood components must be stored at proper temperature, in controlled storage conditions. Improper storage can affect blood safety and effectiveness. Tested vs untested blood. Blood centers must keep tested blood, untested blood in separate storage areas to prevent accidental use of untested blood. Blood units must also be properly labeled with blood group, serology status, expiry date. Disposal of reactive blood. If blood units test positive for infections, they must be discarded, disposed according to SOP. This prevents unsafe blood from entering the transfusion system. Safe use of blood. One of the core requirements of COP-8 is ensuring that blood is used safely and rationally. Hospitals must have a blood transfusion SOP covering blood procurement, cold chain maintenance, patient identification. Patient identification before transfusion. Before transfusion, hospitals must verify patient name, unique ID number, blood group compatibility. Correct identification prevents mismatched transfusions. Cross-matching. Before transfusion, compatibility testing called cross-matching is performed. This ensures that donor blood is compatible with the patient. Preventing mismatched transfusion. Hospitals must ensure correct patient identification, correct blood unit verification. This helps prevent wrong blood transfusion events. Monitoring during transfusion. During blood transfusion, patient monitoring is essential. Monitoring includes pulse, blood pressure, temperature, signs of transfusion reactions. Early detection helps prevent serious complications. Hospital Blood Transfusion Committee. Hospitals must establish a hospital blood transfusion committee. The role of this committee includes ensuring rational use of blood, monitoring transfusion practices, conducting transfusion audits. Committee members may include clinicians, blood transfusion officer, nursing staff, quality coordinator, hospital management. Emergency blood availability. Hospitals must define emergency blood requirement, emergency blood availability time. Hospitals must also define routine blood issue turnaround time, emergency blood issue turnaround time. Monitoring transfusion reactions. Hospitals must detect and monitor transfusion reactions. Examples include fever, allergic reactions, hemolytic reactions. These reactions must be documented and analyzed. Hemovigilance Program. Hospitals should participate in the Hemovigilance Program of India. This national program helps monitor blood transfusion safety. Transfusion Quality Assurance Program. Hospitals must implement a quality assurance program for transfusion services. This includes participation in External Quality Assurance Scheme, EQAS, proficiency testing. Hospitals should also monitor indicators such as blood wastage rate, transfusion reaction rate. Common NABH non-conformities in COP-8. During NABH assessments, common observations include blood transfusion SOP missing, weak patient identification system, transfusion reactions not documented, blood transfusion committee meetings not conducted, cold chain documentation missing. Hospitals should address these gaps to avoid assessment non-conformities. How hospitals can become COP-8 compliant. Hospitals can comply with COP-8 by implementing blood transfusion SOP, establishing a blood transfusion committee, monitoring transfusion reactions, maintaining cold chain monitoring, implementing transfusion quality assurance programs. These steps help hospitals effectively comply with NABH COP-8 standards. In the next video of this NABH training series, we will discuss COP-9. The organization provides care in intensive care and high dependency units in a systematic manner. If you want to learn NABH standards step by step, then like this video, subscribe to the channel, turn on the notification bell, so you never miss upcoming NABH training videos. This is MediQuality Partners, your trusted NABH guide. Thank you for watching.